I'd like to welcome everybody to our session today that's entitled Healthcare Rights Are Human Rights, a discussion on cancer health equity, and very much more broadly about human rights and health. And just for those of you who are attending, welcome. And please type your questions into the Q&A, not into the chat, but the Q&A. We'll have a couple of minutes, about a half an hour of a talk from Loretta, and then we'll have a panel discussion. So we're extremely honored today to hear from Loretta Ross. She has been described as an activist, a public intellectual, and a professor. She's taught at Hampshire College, Arizona State University, and Smith College on human rights, calling in the calling out culture, white supremacy in the age of Trump, race and culture in America, and reproductive justice, among other topics. She's co-written at least 3 books on reproductive justice and has been a powerful activist for many topics, especially around feminism and reproductive health, call-out culture, and other issues relevant to our current social landscape and health system. There are, among many honors and recognitions she's received for her work, have been included the recipient of honorary degrees from Smith College and Arcadia University. And I just want to welcome her and thank her for a very thought-provoking time today. And so Loretta, please share with us what you've been thinking.
Well, I have to honestly say, first of all, thank you for inviting me. It's always an honor to speak with such distinguished people. I think I want to start by saying when I discovered the framework of human rights in a different way, because at the time in the middle of the 1990s, my boss was Reverend C.T. Vivian, who'd been an aide to Dr. Martin Luther King. And he very famously used to say, when you ask people to give up hate, then you need to be there for them when they do. And at the time, his message didn't resonate with me because, when you're fighting the Ku Klux Klan, if they're okay with hating Black people, I'm okay with hating them back. But CT went on to extend his message. And he surprised me by saying, Martin, because he was familiar enough to say, Martin never meant to build a civil rights movement. We're supposed to be building a human rights movement. And at the time, I felt like the kid, like, what you talking about? Because everything I knew about Reverend Dr. Martin Luther King, civil rights leader, it was like all one word, And so he pulled down Dr. King's last Sunday sermon, March 31st, 1968, 4 days before he was assassinated. And Dr. King said there's a triple revolution taking place, a revolution in weaponry with our ability to destroy the planet, a revolution in communications with our ability to talk to each other. He said, but the most important revolution is that freedom explosion called human rights. And I never knew that Dr. King not only had a dream, but he had a plan that we were supposed to be building a domestic human rights movement. And so CT and I and Shulamith Koenig, an Israeli American, and Abdullahi Al-Nahim, a Muslim American, went on to found the National Center for Human Rights Education in '96. And our job was to provide popular education about human rights because we believe that if we who were seasoned activists didn't know about this, what about the general public for whom these human rights mean the most? Because the people who have the least in life need the most from human rights, as has been said. And so that's my specialty that I've been doing since the middle of the 1990s, providing popular education on human rights. And I think I attracted your attention, Tim, when I was integrating human rights into a public health presentation I was doing in Massachusetts. And so I'm going to start by talking about not only where human rights came from, which is familiar to most of you on this panel, so it'll be a bit pedantic, I'm sorry, but also how we have changed what is meant by human rights in recent decades. Because when you say the phrase human rights, to most people, what the image that comes to mind is that tortured political prisoner in a jail somewhere who's denied food and freedom of speech and stuff like that. And so that allows people to think of civil rights at home in the United States and human rights abroad, kind of bifurcation. That is the popular understanding. But I always start not with the United Nations and its arcane practices, because it's kind of hard to decode the UN, but start with how they came about. And of course, as we all know, the human rights framework has been talked about for centuries. I mean, Frederick Douglass first said the phrase human rights in 1858, and Thomas Jefferson talked about human rights. So it's not a new concept. But in 1945, after the end of World War II, the world community belatedly recognized that they needed a body of laws, standards, norms, and conventions to address what had not been attended to. Because the Nazi Holocaust against the Jews, while it was totally immoral, was not illegal. Because governments have a distressing tendency to legalize immoral actions all the time. The same way the United States legalized slavery and legalized genocide against Native Americans and are treating Haitians on the border. While it's not legal, immoral, it can, yeah, illegal, it can be immoral. And so, under the leadership of former First Lady Eleanor Roosevelt, she pulled together a committee that for 2 years worked to author the Universal Declaration of Human Rights, and presented it for affirmation to the United Nations December 10th, 1948, which is why we now celebrate December 10th as Human Rights Day. And I told you this was going to be very pedantic because y'all know all of this, but I don't assume that the audience does. And so I'm repeating the obvious. In it, they laid out categories of human rights protection, some of which we'll be familiar with and some of it will be new. Because we're most familiar with the categories of civil rights, the right to be treated as an equal to anybody in society, the non-discrimination rights. And because we've had civil rights movement, most people think that that's all there is to human rights, the right not to be discriminated against. And there are new movements claiming these non-discrimination rights, like the LGBTQ movement is a civil rights movement. The disability rights movement is a civil rights movement because they have not achieved basic equality yet. But beyond that, there, of course, are political human rights. And to the extent that most Americans are familiar with the human rights framework, because it was so largely based on the US Bill of Rights, we're used to things like freedom of speech, freedom of association, the right to vote, seeing those as constitutional rights, but they're actually human rights, though we recently noted in the last couple of decades that we don't necessarily have the rights to have our votes counted, as Bush v. Gore proved, nor can we resist, apparently, the desire by some people to enact voter suppression across the country, of course, which is another violation of human rights. And then beginning in the 1990s, a new movement for human rights activism developed, mostly largely led by women of color like myself, who were going beyond civil and political rights, the first categories, and putting a higher emphasis on three other sets of rights: economic human rights, the right to have the economy managed in such a way that it meets the needs of its people, and not necessarily only Wall Street. As we used to famously say, why can we bail out Wall Street and not Main Street? You know, and of course the fight for the 15, a living wage, all of those are economic human rights. We also insisted on social human rights, which brings us to this conversation, where our human needs are translated into human rights. And those human needs can be seen as the right to health care or education or food or clothing or social services when we're not able to take care of ourselves, like unemployment and disability, and support for women and children if in special needs. And social human rights are most easily understood if you think of how every child, for example, has a right to an education as their human right. But a blind child might need her books in Braille. So she has special needs you have to attend to so that she can get the same human rights as a sighted child. And that's how you use the concept of intersectionality to look at what special vulnerabilities do people have that have to be attended to so that they can get to the same human rights that people without those vulnerabilities have. A lot of people are confused when they think about intersectionality because they only think of it as an identity. No, it's actually a statement of vulnerability. I mean, that if you're a Scottish bagpipe player, that's not an identity that makes you vulnerable unless people dislike bagpipes. But it's a way to understand how important social human rights are, and that's where we should locate, I think, most of our conversation. And the other category that we bring into conversation in the 1990s abroad was cultural human rights, freedom of religion, freedom of language, the right to get services in the language of your need. Um, but I should say, when I say freedom of religion, we in the women's movement fight for freedom from religion, which is the right not to have other people's religions imposed upon our bodies if we don't share that faith. As a matter of fact, we're particularly upset when Catholic women use birth control as much as non-Catholic women, yet the church is all up in our bedroom telling us what to do, and we're not even Catholic. I mean, what's up with that? And then starting after the UDHR was written in 48, new social movements began to demand new human rights. And so by the 70s, we were talking about environmental human rights, the right to a clean environment, to not having the water system poisoned and land homes built on top of toxic landfills and climate change and all of that are environmental human rights. Then also starting in the 60s, what we now call the global south was then called the developing world. And they're the ones that started talking about developmental human rights, the rights to control their own natural resources and not have Western governments use their militaries to steal their oil, their gas, their natural resources, and things like that. And I think an argument could be made that nearly every war the United States has promulgated since World War II has been about fighting over developmental human rights, the belief that we don't have to explain how the oil we need keeps being under other people's sand. So we just go to war with some other kind of explanation when it's really about those natural resources. And I think climate change is going to increase the competition for natural resources and the likelihood of wars, as well as produce about 200 million global refugees that we're going to have to deal with. And the eighth category has been articulated as called sexual human rights. And these, again, started in the 70s with the US women's movement, particularly when the World Decade for Women was organized by the UN that ran from 1975 to 1985. And these sexual rights are like the right to determine if and when you'll have children, if and when you get married, the right to use birth control, abortion, and then it sounded so attractive because we were talking about the right to sexual pleasure and things that then the LGBT movement started defining itself as a sexual rights movement. Now, those were the 8 categories that are most commonly talked about, but I would emphasize that human rights is not a finite category. It's not a closed deal. New rights are emerging all the time. I'm convinced that the ninth category of human rights is going to be digital human rights because we are quickly approaching the time that if one is not digitally connected, you're not going to be able to get education, healthcare, banking, a whole lot of life necessities are now attached to whether one is digitally connected. And those on the other side of the digital divide will actually be getting substandard services and maybe even not seen as equally deserving of human rights because of their lack of access. And because I majored in chemistry and physics, so I'm a science nerd, and so I like to think that the 10th category of human rights, which is becoming even more imminent, is the right to participate in space exploration. Because it shouldn't just be the billionaires who can take rockets to other places and stuff like that. And so I give this very didactic overview of human rights to talk about the capaciousness of the framework, its adaptability, its flexibility, and I want to move towards closing and talking about when they spelled all of those aspirations out in the Universal Declaration of Human Rights, then it became the opportunity and the obligation of governments to turn those aspirations into laws that could actually affect people's lives. And so then that's when you had the development of the International uh, Convention on Civil and Political Rights, as well as the International Convention on Economic, Social, and Cultural Rights. But that was also affected by Cold War politics between the United States and the Soviet Union. So the United States largely took the position that only civil and political rights were the ones that they were going to prioritize and focus on. And the Soviet Union said the opposite, economic, social, and cultural rights. So they bifurcated what should have been indivisible, because freedom of speech is indivisible from freedom from hunger. Because if you're hungry, what you got to do? Just tell people you're hungry? I mean, what is it? It's not something that should have been divided. And so that intervention, I believe, by women of color in the mid 1990s heralded bringing those frameworks together that had been divided. And I'll just offer this one example from my lived experiences. In Georgia, we were fighting for raising the Georgia state minimum wage, which at the time was $2.15 an hour, I believe, because the state had basically said that it did not have to pay, it did not have to require people to pay the federal minimum wage if the companies did not receive money from the federal government. So we had a sub minimum wage regime taking place. And so in our fight to raise the state minimum wage to the federal level, we got visited by Pierre Sarnet, who was then Secretary General of Amnesty International. And I was there in the parking lot with Secretary General Sarnet when he said, Amnesty is going to start talking about economic and social and cultural human rights more, and not just civil and political. And so I just tell you that story to talk about how people at the grassroots can change major organizations, major institutions, and bring back together what never should have been divided in the first place by Cold War politics. And in closing, I like to think that because of this work that many organizations have done, and in the US, there's now a group called the US Human Rights Network that we also organized to congregate 200 organizations that were focusing on human rights violations in the United States and working on preparing US shadow reports to the UN for the treaties the US has not signed or ratified, those kinds of things. But I like to think that we've had an impact because now it is very common to hear people say healthcare is a human right, or workers' rights are human rights, or a clean environment is a human right. But that was not the case before 1995. That there was civil rights, there was social justice, and then there was this thing called human rights that people did in other countries. And so we made our tagline, bringing human rights home. And that's what the work I've been engaged in since that time. And there's no avenue of work or lecturing or teaching I do that does not include a healthy dose of basic human rights education. And the reason I know this is necessary, that I began the National Center with doing a national survey of what Americans knew about human rights at the 50th anniversary of the UDHR in 1998. And it turned out that only 7% of the American public had even heard of the Universal Declaration of Human Rights. 93% of our public had never heard of one of the most important documents in human history. And I maintain that's intentional, that there's been a conservative effort to keep human rights out of public discourse, keep it out of our educational systems, keep it from being something that is infused into our moral conversations, our political and our economic and social conversations, and our legal conversations. I think that there are people who are opposed to human rights who do not want that to happen, and they've been consistently opposed since the 1940s. As a matter of fact, John Foster Dulles, who was Secretary of State one time, wrote an advisory memo to the president and said, we need to be careful about this human rights thing because we don't want our Negroes to get agitated. And he was arguing ignoring human rights as a way of continuing Jim Crow segregation. And so there's been a political commitment to keeping human rights out of the view, out of the ken of the American public. And we've been trying to break through that logjam forever. And so I need to shut up and thank you all for giving me this opportunity. But I think that we have the opportunity to make the 21st century the century of human rights. It's been a long time coming, but the young people I see do not like living in boxes of single issue boxes. They live intersectional lives, they require an intersectional analysis, and mostly they require a vision of what we're fighting for instead of just what we're fighting against. And so when I tell them about the human rights framework, they're all over it. And so I'll shut up and now I'll let the panel speak. Thank y'all for listening to me.
I certainly don't want you to shut up at all. In fact, quite the opposite. It's fascinating to hear this perspective and to think outside of the usual constraints that we in public health tend to use, the terms, the concepts. And so I'd like to continue with the discussion and have you included in the discussion. I just want to bring in our two panelists. First of all, Nancy Krieger is the professor of social epidemiology in the Harvard Chan School of Public Health and director of the Interdisciplinary Concentration on Women, Gender, and Health. And Natalia Linos is a research scientist and executive director of the FXB Center for Health and Human Rights at Harvard. And I'd like to bring them into this conversation that you've so nicely started to think a little bit about how human rights and human health intersect and how we might be able to think about using the relationships and the concepts of human rights to improve public health, improve human health. Let me start by asking Nancy if you have thoughts about the very interesting concepts that Loretta just presented to us. Anything you would like to add about those concepts in the context of health and the work you've done? You're muted.
Famous words. Thank you very much for having me on this panel, and it's an honor to be on this panel with Loretta Ross and also to be on a panel with Natalia as well, a good colleague. And I come to this as someone who is a social epidemiologist, also a cancer epidemiologist, to tie to the concerns that you have, Tim, about cancer. And a lot of what you've just been saying, Loretta, very much resonates with the history that I have of my experience and exposure to human rights and where that was relevant to public health. So I became much more aware of it also in the 90s. And part of that was about also what was going on with the work around HIV/AIDS in particular, of really bringing in a non-discrimination framework that had to go beyond the usuals to figure out how do you actually give care. And then watching the field push in the ways exactly that you described to go from saying that there are individual violations of rights to understanding socially what's going on population level, that the inequities in health become something that we can talk about from a human rights framework, and that the human rights framework exactly did what you were describing of bringing together the indivisibility of the 5 initial domains of human rights and said, we understand these together to understand what is driving health inequities, but also, as you said, very important, and this was important to me as well as an individual, going with the very strong social justice framework to always have that thing, yes, anti-racist, yes, against capitalist exploitation, yes, against this, that, and the other, but what do we stand for? And that the human rights framework gave an opportunity to articulate a vision of what we stand for and what would an equitable society look like that valued every single human, with every single human having the same dignity and therefore the same possibilities of thriving on this planet. So it's been very important, I think, in population health work and in public health work to bring in that human rights framework, to understand that it's a conjunction with concerns around many of the different specific issues that people will often focus on: the economic inequity, the structural racism, the interpersonal racism, the injustices tied to misogyny, the issues around reproductive justice, or the introductions, as you're also bringing around, where LGBTQ rights fits into all of this. I'm saying it's not just only rights, but it's understanding that this is a population phenomenon. So it's a population phenomenon in terms of both, A, what is this government doing or not doing to uphold these rights, not just prevent violation of rights, but actually to further the ability for people to live in that kind of context of having their human rights respected, fulfilled, living in dignity. And then also, what does it mean for population health if those rights are not being followed? Not just individual violations, which have been so much before the case. It was framed as there's an individual violation of rights, which really, really matters, but understanding it as a population level. So I just want to say that, what you're talking about very much resonates with the kind of critical frameworks that I think can be and are increasingly used. But what's important is that they bring an element that's whole society, that they're not these abstract, simple, quote unquote, social determinants of health. They're located within the institutions and agencies that people have created, people can alter, and people can improve for the better. So I can stop there. I have specific thoughts about where cancer fits into all of this, including in relation to the COVID pandemic, if those are at all relevant. But I just want to, offer an appreciation for the critical necessity of educating people in the US, as you have been doing, about also reminding people in this country, human rights are not just something that are just like an arbitrary set of opinions. There's actually lots of legal doctrine. There's international conventions. It's not just like the idiosyncratic view. It's actually upheld across the world or violated across the world, but that framework exists. And secondly, why in the US the discussion went so sharply, tied in part to Cold War politics, to a focus on civil and political rights only. The debates that had happened even in this, what became the civil rights movement, about should there be, what it happened in San Francisco in 1948, should there be an emphasis on human rights versus civil rights, and what it means to educate people in the United States that this bigger framework exists and it's operative in the globe. Many people in the US are trained to think in the US exceptionalism, ours is the best healthcare system, ours is the best whatever, when the actual evidence are to the complete contrary. So I feel like expanding the framework and a realization and knowledge about what human rights actually are and how they become a real important vehicle for shaping action to be able to realize those rights is invaluable for everyone in public health and beyond.
Thank you, Nancy. I think that those are, it's interesting that you use the concepts of the disparities, equity, inequity, which are obviously so importantly tied to human rights. And yet we don't frame equity when we talk in a public health setting about cancer health disparities or any disparities. We don't frame it in the context of the fundamental principles that Loretta was just talking about. Loretta, do you have any comments on what Nancy just said?
Well, I think that Nancy is talking about the application of the principle, of the theory, that people are vulnerable to pandemics and AIDS and viruses because they're living in a condition where their human rights were already being violated. We watched the people who had the most precarious existence become the people who were most likely to contract AIDS. And back in the early 90s, when I first started paying attention to the virus, the time from death to diagnosis was months. I mean, literally months because of the precarity of their existence. And we've had so many efforts to establish a quality healthcare system. FDR was trying to do universal healthcare. I mean, how many presidents have tried, well, Democratic presidents have tried to do universal healthcare just to get beaten back by the amassed power of those who profit from injustice. And I don't think that's ideologically driven. I think that there are people who see the present system as enriching their wallets so much that they're not at all caring about how many people have to die on their way to the bank. And so we have lagged behind in so many ways, and COVID just exposed all of those faults within our healthcare system and continues to expose them. But mostly it's also exposing the ill education of the American public around how our government works, how science works, how a pluralistic society works, how democracy works. I mean, every fault line possible has been exposed through COVID. And we are not going to survive this threat to democracy and this threat to public health unless we make a sharp turn from the status quo. We cannot just tinker and do business as usual and arrive out of this as a whole and functioning society or as individuals with the society. And unfortunately, I think I wrote a little snarky editorial a couple of years ago, and I said, you can't shoot a virus with a gun. So buying all the guns in the world is not going to protect you from COVID. I mean, just how we have so many false solutions because these false solutions are profitable to people is a sad indictment on how we socially fail as a country, and we can do much better. But I also believe in young people because they got it.
Yeah, and Natalia, as a social epidemiologist, you've thought a lot about inequities around COVID, about other environmental occupational exposures, gender, poverty, things like that. What, from your perspective and from an FXB sort of perspective, how do you put that into the context that Loretta is talking to us about in terms of human rights?
Thanks so much, Tim, and thank you, Loretta, for sharing that history. I worked at the United Nations for over 10 years, and I feel like I need that reminder. So I think it is really helpful. I think the challenge that COVID is, to me, making clear, and also climate change and some of these bigger questions, is does a human rights framework which requires governments to protect the rights of their people, how do we talk about it when some of the challenges are cross-national, or when some governments like the United States or Canada or European countries are hoarding vaccines and not sharing them with the rest of the world, and therefore they're protecting the human rights of their people, but in that process are denying the rights of people elsewhere. And on climate change, similarly, how the actions, maybe the right to a clean environment is easier if you think about it in terms of toxins or lead, but it's different if you're, the Marshall Islands and your people are literally going underwater because of actions outside. So the human rights framework, and as someone who believes deeply in the UN and the human rights framework, I'm struggling right now. And I wonder how that, how do we protect rights that aren't of your people? If you are not your government, or can we hold the US government accountable for polluting the earth and China and the big, 7 countries that are causing climate change? Like, can they be accountable to the people of small island developing states? And I don't think we're there yet. And in terms of a frontier, I think that's an important frontier. And in terms of health, I think it's important to say that the right to health is the right to the enjoyment of the highest attainable standard of physical and mental health. And by saying the highest attainable standard, I think that's where equity comes in very clearly. If people in the United States are living, or Japan or other places, into their 80s and 90s, and other countries have a life expectancy of 50 or 60, clearly those people are not living to the highest attainable. So it's within country inequities, but also the across countries. And when it comes to cancer, I think it's tremendously stark, the difference in terms of chances of myself, if I am screened for breast cancer, surviving that versus, or cervical cancer, surviving or dying from it if you're in a low income country or not. So I think a lot of times the human rights framework, to me, is tremendously helpful, but it's still limiting because it doesn't address some of these cross-country challenges, which are real, and the inequities. And so I don't know, Loretta, if you've struggled with that at all, and I would love to, or Nancy, about how, is human rights really something that a government is responsible for their people, or is there like a higher international human rights that we can talk about?
Well, I think those of us who embrace the human rights framework clearly understand its limits, because a state-based system is woefully inadequate to deal with transnational problems. Pandemics don't stop at borders, refugees don't stop at borders, environmental problems, crime, money, corporations don't stop at borders. And so a state-based system feels very antiquated given the nature of the threat. But that's a matter of execution. That's not a matter of values. I think the values are universal and transcendental, but whether or not a state-based system can protect those values and the laws and implementation strategies necessary for them, that is a very legitimate question. And so we in the human rights movement are always asking, will it take ET coming to the planet for us to figure out that these colonial borders don't make sense? And what else can we imagine can happen?
So what I'm hearing from this discussion may be fairly obvious, but that there's a disconnect between the principles that we probably all would agree on, even the people that are working against those principles would probably agree on, yet the implementation of these principles is not happening in a way that will end up benefiting everybody. And I just wonder, if anyone of you want to comment on, the people who actually are benefiting from the current system, the people who, the governments, the corporations, the whoever it is that's really benefiting these. And if you follow the money, you can figure out who those people or groups are. Are there ways for us to align better people's motivations for power or money or whatever it is that's causing human rights from occurring in a way that we all believe should happen? Are there ways of aligning those people and those corporations to achieve the things that you've been telling us about, Loretta, or any of you?
Would it be okay to jump in, Tim, though, on the very first point that you were saying?
Please, yeah, please.
Because I think in this exchange, what's very valuable to me about what Natalia and Loretta are talking about is that there is going to be nobody outside the world that's going to come in and save us and guarantee human rights. And that it's really critical that there are these international conventions that set a standard that people can then organize for in their societies to say, this is a right, we should have it. I think about for example, the Declaration, the International Convention around racism. It's really crucial being able to bring that in and point to that as a standard that has to actually get attention in the US and to change what is being done, and for people to make their governments responsive to that. To understand it and frame it as a right is really, really important. There are rights that the US has not signed on to, around the Convention of the Child, for example. That matters, and you hold that up, and if there were not this global framework of reference, what happens in individual countries would be, well, why not? Is it just up to each country? So I mean, my understanding is that, back to the point about these being universal, or said to be universal human rights, thus universal values, that's applicable to actually every single human being, no matter where he, she, or they happens to be in the world at a given point in time, sets a crucial standard for what the activism needs to be to make those governments comply. And governments, whether the governments are supporting the interests of those who have particular financial vested interests that are private versus the public good, that's a very big political question. That's what part of what gets fought out. And the human rights framework helps articulate what some of the contradictions are of a government that says that it's meant to be for the entire nation and is in fact gearing its policies to a very small and rich minority. So I think that I would say that it is meant to be an international framework, and every country has to step up. And figuring out, I mean, part of it is also what I hear is a different question, is that usually the violators of human rights have been framed in state systems. But what happens when you have private actors that are the ones that are violating rights? How do you start to enforce of human rights framework and human rights understanding? For example, if you want, on corporations, particularly looking at, for example, medicine as a business in the United States, and what the fights have been over, does the health insurance and having it be private health insurance versus a public system, that many other countries that are also, by the way, quote unquote capitalist, they're just different varieties. I mean, Norway is a capitalist society, but they managed to have a very different kind of health system that's national in terms of social democracy. So, so I think it's really important to bring this back to saying that there are fights over political economy and whether there should be gross inequities in the vast concentration of wealth among a tiny number of people that's grown up astronomically, including during COVID. I mean, the amount that the proverbial billionaires have extraordinarily increased what their private wealth is during COVID, particularly in the industries tied to what you were saying, Loretta, about the quote unquote digital economy and what that fits in there is, and the amount of immiseration on the other side is just extraordinarily stark. So that's where you can really follow the money. And that speaks to whether there's a billionaire's pandemic tax and much else that, is being put forward in the framework. But I think that the universality of human rights is what gives people, because a real stand to say what the conditions ought to be that people can get to that, as you were discussing, Natalia, the highest attainable health. Because that's the other thing. Everyone has a health status. Everyone is a living being. Everyone is going to, at some point, be ill. At some point, everyone will die. But with what degree of preventable suffering and at what age is a huge question, and human rights factors enormously into figuring that out.
Well, you had asked about pathways forward, Tim.
Yep.
And one thing I found as a human rights activist, and now I'm writing a book on calling in the calling out culture, so I'm pulling together those two streams, is that even amongst the 1%ers, there are sharp political differences. And the smart way for me to figure it out is which are those very rich people who care more about human rights versus those who don't? Because I don't want to paint them all with the same broad brush. It's the difference between a Nike corporation and a Reebok. I mean, you have to be able to do a high quality analysis of who is likely to be an ally, however problematic, and who's going to actually be an opponent. And not assume because of somebody's class or identity or status or race, gender, or anything, that by definition, they're not a possible ally because of your preconceived notions of who they are. The beauty of the human rights framework, and I know this is so paradoxical, is that we have to always consider even the human rights of those we oppose. You can't violate human rights a little bit to protect human rights. It doesn't work that way. And so I call on us to be far more strategic than I think we've been, because historically we've organized kind of like in an us versus them mentality and use issues of identity or class or race or something to bifurcate almost in an angel devil theory that's neither true nor effective. But I find that it's very possible to have different conversations, because anyone that doesn't understand the difference between a George Soros and Sam Walton hasn't done their homework. Both billionaires, but definitely cut from different cloth. And so I believe that there are tremendous possibilities if we figure out a way to have people's inner good opinions of themselves match their outer behaviors. I think the age of Aquarius is calling on us to achieve a global justice alignment. And I really do believe in that. I don't want to get too woo-woo because I'm not a woo-woo girl.
Yeah. It's amazing, and I think that your what I'd like to hear, maybe you could comment a little further about, how do we develop allies from all sorts of different quarters? Because, it's true, not we can't bin people into, good and bad just based on how much money they make or what their skin color is or whatever it might be. How do you nurture building an ally when you're talking about groups that are so distinct and so diverse to achieve a human right?
I don't have all the answers. I just have lived experiences. In the 70s, I was a rape survivor who taught Black feminist theory to men who were incarcerated because they had raped and murdered women.
Mhm.
With Reverend C.T. Vivian, I'm a survivor of racial violence, but I helped deprogram people who've been in the Klan and the neo-Nazi movement. As a feminist, I've always been on the margins of what a movement led largely by white women who didn't understand their whiteness, so that they embodied quite a bit of internalized racism and stuff themselves. And so, but the only way any of us build power is by working with other people who don't share our identities, who don't share our statuses and stuff. If we could all do it by ourselves, it would have been done. If Black people could overthrow white supremacy without white people, it would have been gone a long time ago. And it ain't. So that means we've got to do it in a way that's smarter, more effective. I find in all of those instances that I just mentioned in my past, it was about working on that cognitive dissonance, what the psychologists call. Because a lot of people, even standing in front of me in a Klan robe, they have an inner good opinion of themselves that does not match their outer behavior. And that's the sweet spot. How do we help them understand how to align those two parts of their soul so that they can be at better peace within themselves and a bit more and contribute more to the world besides hatred, envy, and fear?
Wow, that's an incredibly powerful statement. I wish I will give a lot of thought to that. I hope our audience will too, because it's very hard what you just said. What you just said is not an easy thing for most people to live. So thank you. But I, bringing it, there's a couple of comments in the chat that I really would like to sort of generally address. And some of those comments are talking about, at least the way I read them, this disconnect between our health system that's grown up outside of a framework of human rights. I mean, that's the way I see it. And there's a couple of things here in the chat about how the intersectionality of personal trauma history and trauma-informed care, delays in diagnosis and screening, access to drugs, cancer drugs that people can afford. That to me sounds like a disconnect between what the health, well-being, public health system, the medical care system has evolved outside the context of a human rights framework that you're describing to us. It's developed because of, well, maybe good intentions, but maybe money or things like that. I don't know if Nancy or Natalia want to comment about how we can bring our health care systems, our public health systems, to be aligned better with these human rights framework principles that we've heard about.
I'm happy to jump in with one comment into actually one that you didn't read is from Professor Stephen Marks around the Article 27, which says everyone has the right freely to share in scientific advancement and its benefits. I think the big kind of elephant in the room is intellectual property. That right has superseded human rights in so many ways. And, for those who follow sort of international negotiations, TRIPS, that agreement has been such a challenge for the public health community because right now, it's like, how do we share scientific advancement if we're also trying to protect corporations and their benefits and pharmaceutical companies and all of that? And I think, it's played out in COVID. It has played out in the question above around, cancer drugs and, who has access to them? Are they at cost? The HIV movement that Nancy mentioned succeeded in dropping the cost of, antiretrovirals, but that required so much activism. And on the point of hope, Loretta, you talked about the hope that you have in young people. I have the same hope because they can create that transnational social movement. And it is holding their own governments, but also supporting each other's. And I have seen it on the climate movement, but also in other movements. But I do think that the elephant in the room is intellectual property rights are kind of trumping human rights, and that we should say.
So can you comment a little bit more maybe, or any of you comment a little bit more about how we address those structural things that, I mean, how are we going to address, intellectual property rights, change that so that it better aligns with the human rights principles we're hearing about? It seems like a really tall order to actually implement.
I mean, I don't want to jump in and answer. I think Nancy might have some thoughts.
Yeah.
I don't know. I think one is naming. I think naming that as a core challenge is important, that we know, because there are exceptions, that there are, public health on the books is one of the reasons where intellectual property rights should be lifted. But we were in the midst of a pandemic and we didn't see that happen on day one. So Nancy, I don't know if you have more thoughts.
I mean, I think that this is where, again, the value of the human rights framework and the possibility of force of government behind it is really useful. Because, government, certainly in the United States, has issued certain executive orders in relation to what government power is to further the public health, what needs to be done here. And bringing in the human rights framework about saying what ought be done is really important. It's not just naming, it actually starts to mobilize. So then watching the people that have been organizing in the US, but with connections around the world about the vaccine distribution, and also getting clear that it's not just about vaccine distribution, because it's also about making sure there's capacity to manufacture vaccine elsewhere around the world. And that gets to the heart of some of this intellectual property issue that you're talking about. And the human rights framework, to me, is someone involved in health. I mean, in healthcare as well as public health concerns, is watching the discussion and the morphing of saying, no, it's not just that healthcare costs too much and it's inefficient and it's this, that, and the other, but that there's a violation of human rights, that people do not have access to a decent healthcare system in this country, and saying healthcare is a human right, saying that health is a human right, has just informed a whole lot of people in terms of standing up to what I think then speaks back to what, Loretta, you were talking about. You have many people in public health and in medicine who are like, aren't we supposed to be taking the best care of people we can and preventing the preventable suffering that we ought? What's getting in the way of that? What are the contradictions there? And using the human rights framework to help clarify what those contradictions are, and then saying, okay, how do we change systems? Because I think that part of what the human rights framework also allows you to do is say, what are the values, but also what are the systems you have to change in order to be able to realize those values? So it's not just about personal conviction, but it's about systemic change.
Absolutely. And that systemic change, I think, is what we're sort of walking around right now. And so Loretta's lived experience of talking to someone who has been an abuser or a Ku Klux Klan member, that interpersonal interaction, that's really powerful. But how do you do that when you're talking about the US government or Philip Morris and cigarettes, or are there common principles we can start to think about as people who care about public health and care about the human rights principles you're talking about? Is it that we talk one by one with individuals? How do we motivate these larger entities to have that kind of impact you were talking about earlier?
I'm sorry I had to silence myself because they started mowing my lawn right outside the window.
Life goes on.
Forgive the noise. I find that they're a lot more amenable to having these conversations because of the transition of the 21st century workforce and customer base. I'm getting a lot of inquiries from C-suites in corporate America where a social justice activist is rarely invited to. But I'm talking about Facebook, Etsy, Nintendo, places that are recently calling on me, not because I know anything about corporate America except to be anti-capitalist, but they're calling on me because their workforce is younger, queer, browner, more female, more intersectional, and they have keyboards that can blow them up. And they're coming to the belated realization that their worst critics are on their own payroll.
So it's a moment in
Don't know
time
what
that they
to
feel the
do.
need to respond to.
And then on the outside, they're noticing that their most prized customers are buying with their values as much as their wallets. So they're in a squeeze right now from both the inside and the outside in the 21st century that nothing they learned in the 20th century has prepared them for. And this is a precious moment of opportunity for some real transformational change. If they're not going to do it because they're inherently good people, they're doing it because they are answerable to shareholders and stakeholders who are demanding that they rise to these 21st century challenges. So it's been fascinating to be in conversation with people that they would have invited me to come in and talk to them about calling in and, DEI and stuff that I guess a little while ago, because they're being blown up from inside and outside.
Yeah.
No one ever calls in a consultant unless they're already in trouble.
Well,
So I'm kind of excited about the friction that's going on.
yeah, social pressure is a powerful force, absolutely. So we just have a couple minutes left. Could I just ask each of you to give just a couple last big picture thoughts you'd like to leave with our audience today? And Natalia, anything you'd like to make sure we all remember?
I mean, I liked your comment, Tim, right now that social pressure is important. And I think for the audience, if it's a public health audience who are researchers, I think spelling out, articulating the inequities that we are seeing in cancer, I assume most of the audience is cancer, both within our country and globally, and creating outrage around that, whether the drivers are racial or ethnic inequities or poverty or environmental exposures. I think it's really important, and linking up that research with the activists who can put the pressure on governments. So, yeah.
Fantastic. Nancy, your thoughts?
So to also build on something that Loretta as well said earlier, is that it's really important that we're having this conversation in a moment of the COVID pandemic and the connections to cancer, which are again, the embodied connections that come about because of us being the biological beings that are social beings that we are in this world, and the necessity of a human rights framework and making the links and understanding. COVID has absolutely torn the cloth from all these inequities that were there. Cancer researchers knew that there were inequities in access to cancer screening, in treatment and diagnosis, in care, in survival and mortality. It gets that much more exacerbated under the COVID conditions, where there's more research going on, but not every country has done equally badly. So, for example, New Zealand has done an awful lot better in figuring out how to keep its healthcare system functioning despite COVID than, for example, other countries, even within somewhat some analogous healthcare kinds of situations. So COVID gives the moment for people in cancer to go, wait a minute, the idea is not simply to recover back to the pre-COVID patterns of cancer screening. It's revealing the inequities in cancer screening, for example, that were happening before COVID hit the scene. And so watching the differential, particularly in the US, of the continued differentials of who's gotten back to better cancer screening rates and watching the inequities in that, saying that that's unacceptable. We're not trying to get back to what was before. We need to do much better. And a human rights framework can help us understand what does much better mean and why, and then also can help us understand who are the allies to make these demands for the activism to bring about change. So it's not letting us parse that COVID is over here, cancer is over there, but the spotlight that the human rights framework helps bring to the pre-existing cancer inequities that COVID has exacerbated is part of the moment we're in right now in terms of what change can be made by health researchers, by people that are running healthcare systems, and by the people who are actually receiving those services and in need of the research saying, do better.
Mm-hmm. And I would add to that, you gave the example of New Zealand, but Rwanda, for example, where I do work, has had a very similar positive approach to dealing with COVID. And so it's not just places that have a lot of money and resources, it's places that drive their work, their actions on principle and on values and human rights, which I think Rwanda has really done. It doesn't mean you have to have lots of money. It means you have to have your thoughts and your actions align around a human rights framework to make things happen. So Loretta, last thoughts from you. Thank you so much.
Well, I just want to bring into the conversation our history when we remember what ACT UP and the Treatment Action Coalition did and what impact they had on the pharmaceutical industry and on the government when Ronald Reagan didn't want to pay attention to AIDS and things like that. We've done it before and we can do it again.
Thank you so much. On that very promising note and hopeful note, I really want to thank you and the panel for an incredibly stimulating and thoughtful conversation. We hope we can stay in touch with you because this is something we all need to work together on in order to make an impact on human health, public health. And so again, many thanks to the three of you for your participation. And for those of you in the audience, this is recorded, so I encourage you to let your colleagues and know about this important conversation that's happening and for us to follow up and continue to make impact in a principled way, as Loretta has done. Thank you very much, everybody.